Alright, this is James. This is assessment 5.1, the peripheral vascular system. I'm going to start out by palpating James' carotid. And I'm going to take 2 fingers and on the medial angle of the jaw and just anterior to the sternocleidomastoid muscle and be able to palpate his carotid on left and right sides, and it is present. And then we are going to work our way down to put your arm on your tummy, the brachial artery, and I'm going to be able to palpate the brachial artery with 2 fingers medial to the bicep tendon, and note that it is palpable. And then we're going to palpate the radial artery, just medial and ventral, medial and on the ventral side of the wrist. I'm going to count for 30 seconds, multiply that times 2. I counted his pulse prior to recording, and it's 72. It is regular, it's non-bounding. It is a +2, which is normal. And the symmetry is equal on the left and the right. Whenever they are palpated. I would palpate simultaneously, but I have to hold the camera. So, and we are going to also palpate the femoral artery. Let's see the best way to do this. I'm going to palpate the femoral artery just below the inguinal ligaments between the pubis symphysis and the anterior superior iliac spine, and note that it is present on both sides. I'll repeat on the other side. And for the popliteal artery, we normally have the patient lie prone and flex their leg and support their leg to help it more easily locate that. But James has had some back surgery and he's not able to lay on his stomach, so I'm going to attempt to find the popliteal artery from the supine position, and I'm going to palpate the popliteal fossa and locate the pulse. And we're going to move on down to the posterior tibial pulse, which is palpated just behind and slightly inferior to the medial malleolus. And it is present, but it is kind of, it's weak. James does have some peripheral vascular disease and some restless leg syndrome, so that was probably fairly normal for his disease process that he has. And then we're going to palpate the, right there, okay. Dorsal pedis pulse, which is present. It is regular, non-bounding, and amplitude is probably +2. And we need to note that it is same thing, slightly dorsiflex your foot there. It's palpable on both sides, with the right being just a little bit more than the left side. Okay. You can also mark the pulses for patients such as post-angio patients, and for patients you have to take pulses on more frequently to make them more easy to find. The next thing we're going to do is the peripheral artery auscultation. I'll count my whole camera. Okay. And we are going to auscultate the temporal artery with the use of the bell of the stethoscope, and we're going to check it for bruise. And you should not be able to find a bruise or any swishing, low swishing sounds. Turn this way, and you would Put the bellows stethoscope on the temple and auscultate. Next, we need to do the carotid artery on the anterior margin of the sternocleidomastoid muscle. Okay, I'm going to ask you to take a deep breath, please, James, and hold it. And notice that it's negative for any breeze. Ask him to hold his breath and let it out, so that it does not cause any interference. Let's see. Alright, and then the peripheral vein exam. We need to elevate your head 45 degrees. Let me see if I can help you get up just there. That should be about right. What if that elevate the head about 45 degrees. And then we need to look at his jugular vein along the angle of the jaw and the clavicle. And you should be able to see that there's three waves, and then that notates that he is in normal sinus rhythm. 3 waves is the pulsations of the heart. Let's see, and then for the jugular vein pressure, we place a ruler over the heart, the mid-axillary, where the mid-axillary line is, and then you would place another ruler horizontal to that. There you go. And measure the height of the jugular vein pressure at the level of the highest pulsation. Where the 2 rulers intersect, the reading, you read the one that is